लगा क्या फोन इनको? अरे
फोन नहीं लग रहा है, मेरा भी नहीं लग
मैम,
रहा है।
अरे ये एडमिट करना पड़ता है सबको इधर से, तभी एडमिट हो जाता है। यस,
जितेंद्र
वरना
सबको
सर उठा।
एडमिट ऑल कर दो ना। शिबानी, शिबानी, कोरोना रेमेडीज एडमिट ऑल करिए।
हेलो।
सुवर्णा मैम, वेलकम, गुड इवनिंग। फोटो नहीं होगा अभी।
जितेंद्र सर ज्वाइन करो वेबिनार।
यस
मैम
मैम,
ज्वाइन
यस
कर
मैम।
दिए। सुपर्णा मैम, गुड गुड आफ्टरनून मैम।
ये
गुड
मोनिका मैम गुड आफ्टरनून। नेसर की वेलकम।
गुड आफ्टरनून सर।
ओटी में છે हाँ
गुड
रजि।
इवनिंग एवरीवन, शैल वी स्टार्ट?
जितेंद्र सर वेलकम।
प्लीज वेट, आने दो गेस्ट सब। या ये सबको सिर्फ एडमिट करो शिवानी मैम।
यस सर।
या ऑल एडमिट कीजिए, ऑल एडमिट, ऐसा कुछ है कि इंस्ट्रक्शन दीजिए ना। गुड आफ्टरनून गीतेंद्र सर। सर यू आर म्यूटेड।
गुड आफ्टरनून सर।
सुवर्ण मैम, गुड
Yeah,
इवनिंग।
good afternoon, Madan ji. Good afternoon, Prajanna madam.
हाउ आर यू मैम?
How are you all?
गुड आफ्टरनून
बस
सुपर्णा
बढ़िया।
मैम।
So the third webinar I've joined.
गुड इवनिंग
Back to
पूर्णा
back.
मैम।
You look so nice, ma'am.
Hi
जितेंद्र
Gitendra.
सर वेलकम।
How are you?
So, absolutely fine, madam.
Hi
So far,
Sarfaraz.
गुड इवनिंग सर मैम। गुड इवनिंग।
Prerna.
good
Hi.
evening.
हाँ मैम, गुड आफ्टरनून।
अभी किरण सर का ही एंगेज है कॉल, तो वी विल स्टार्ट इन 1 to 2 minutes।
अगले साल फॉक्सी में वेबिनार्स होंगे कि नहीं होंगी? आई डोंट नो।
मास्टर सर ने तो नहीं बताया है, सिर्फ
नहीं
आईसीयू
नहीं
बताया
होगा।
है। सर ने बोला है फॉक्सी विल बी ऑन लाइव एंड आईसीयूजी विल बी ओनली वेब।
अच्छा।
एक्चुअली वेबिनार होना चाहिए मैडम, ये कनेक्शन थोड़ा कम हो रहा है ये प्रॉक्सी
इट्स
से।
अ गुड वे
बहुत
टू
कनेक्ट,
कनेक्ट एक्चुअली। फिजिकली सब जगह जाना मुश्किल हो जाता है।
हाँ
बहुत
पॉसिबल ही नहीं
सर
है।
अच्छा ये प्लेटफॉर्म है।
ये वेबिनार का प्लेटफॉर्म बहुत अच्छा होना ही चाहिए।
बट क्या होता है ना, एवरीथिंग शुड बी लिमिटेड। इट शुड नॉट बी
यस
यू नो
यस
जस्ट
या
अभी तो ना ये बैक टू बैक में 3 वेबिनार में फिर इट लूजेस इट्स इम्पोर्टेंस।
या
कैसा मौसम है मैम आपके उधर?
थंडी मुंबईमध्ये असते, आहे यावेळी मुंबईमध्ये पण आहे थंडी।
श्वेता वेलकम।
नो
श्वेता मैम।
चांस।
किरण सर से बात हो गई मदन सर?
नहीं, कंटिन्यू एंगेज आ रहा है। स्टार्ट करें? नीरज सर आ रहे हैं क्या?
सर से बात नहीं हुई, सर का फोन नहीं लग रहा। आप एक बार
ओके,
लगा के देखो।
ठीक है।
लगा लगा नीरज सर का लग गया।
गीतेंद्र सर, आप ट्रैवलिंग में है क्या अभी?
Yes, I am just now in Kashmir.
ओ
अरे वाह।
तभी
ज्वाइन
आप
करो
इतने
छो।
फ्रेश, इतने फ्रेश लग रहे हैं अभी।
वाह। नीरज सर ज्वाइन થાય છે। किरण सर का कंटिन्यूसली एंगेज आ रहा है। नीरज सर अभी ज्वाइन हो
हाँ,
रहे हैं तो
तो
2 मिनट
सर
में स्टार्ट।
आई थिंक सर विल ज्वाइन आफ्टर फ्यू मिनट्स। शैल वी स्टार्ट?
यस यस, वी शुड स्टार्ट आई
यस,
थिंक सुवर्णा मैम इज।
शिवानी वी कैन गो लाइव।
Yes, we are live. I have started the YouTube live. Okay. So good evening, everybody. Respected faculties and delegates present over here. On the behalf of Corona Remedies, I, Shivani Bhabra, welcome you all. uh, in the Core Connect webinar series with association with AMOGS.
हेलो शिवानी.
Yes, sir.
हाँ, कंटिन्यू कीजिए.
Okay. Is it visible?
या विजिबल. Okay. Okay, it's okay. I will take over. Shivani?
Okay, sir.
Yeah. Good evening, everyone. On behalf of AMOGS Sexual Medicine Committee, I am delighted to invite you and welcome you all. The Gujarat Obs and Gynae Societies. First of all, I would like to thank all the associated societies of Gujarat and also along with AMOGS. Societies of Gujarat which are associated, these are the 12 societies. This is the actually second episode with Gujarat societies. Now we are having Rajkot, Gandhinagar, Himmatnagar, Godhra, Anand, Nadiad, Bharuch, Vapi, Navsari, Patan, Valsad, and Dahod. I'm thankful to all the office bearers of these societies for accepting our invitation and to connect with Gujarat people. Also, uh, I'm very happy to have the chief guest for today, respected Dr. Suvarna Khadilkar ma'am. Everyone knows ma'am. Ma'am is the Secretary General of FOXI. And today we are having a guest of honor, Dr. Kiran Kurtkoti sir, who is the President of AMOGS, Dr. Gitendra Sharma sir, who is the Vice President of FOXI, and Dr. Neeraj Jadhav sir, past Chairperson, Sexual Medicine Committee, FOXI, and VP-elect West Zone. And I also welcome my co-conveners, Dr. Prerna Keshan, who is the National Convener, YTP Committee FOXI, and my dear friend Sarfraj Kazi from Himmatnagar Society. And I also welcome all the speakers for today's two sessions. And we are having two talks and one panel. I welcome all the eminent panelists and experts are Dr. Mahesh Gupta sir and Dr. Pawan Dey sir. I welcome all. By taking this opportunity, I welcome all the dignitaries for e-lamp lightning. Shivani, please show the slide. Yes.
So shall I start the
Yes,
prayer,
yes, yes.
sir?
Yeah, please. शेयर साउंड नहीं किया शायद. Shivani, there is no sound. It's okay, Shivani. It's okay. Please, may I have the slide of chief guest, ma'am, Suvarna, ma'am? Please display the slide. Yeah. Yeah, we are so lucky to have today's chief guest, Dr. Professor Suvarna Khadilkar, ma'am. Ma'am doesn't need any introduction actually. She is currently the Secretary General of FOXI, very active academician and Foxian, dedicated Foxian, and she is the currently professor and head of the department and consultant endocrinologist and gynecologist at Bombay Hospital. She is also past president of AMOGS, and we wholeheartedly welcome you, ma'am. We are thankful to having you here, and over to you, ma'am, for your blessings.
Thank you. Thank you so much, Dr. Madan. I think I am seeing you that you are working so hard since last I think 5, 6 years, so I'm observing you that you are everywhere. You are conducting program, doing webinars, and I see this particular program also. You're already a chair of the Sexual Medicine Committee of AMOGS. AMOGS is doing a wonderful job under the presidency of Dr. Kiran Kotakoti and Bipin Pandit. And I'm so happy to have Dr. Geetendra, Dr. Kiran and Dr. Neeraj Jadhav as my guest of honors. It's an honor to have you all with me on the same platform. And everybody has witnessed how hard Dr. Neeraj has worked on, sexual medicine when he was the committee chair of FOXI. I think this particular area of sexual medicine is such area that the doing lot of work, and I think he had earned one award, Foxy Award for Best Committee. So it is very difficult to do continue to do good work. And I remember Neeraj's work, and I also remember Dr. Shantanu Abhyamkar, who was also the chair of Sexual Medicine Committee. He is no more with us, but I distinctly remember that he had put up such great work during his tenure, 3 years tenure as the chair of FOXI's Sexual Medicine Committee. So I think, and this particular subject, we were never taught as undergraduate students. We were never taught even as a postgraduate. I don't remember a postgraduate any book or any book chapter in our standard textbook. We were taught by our teachers in addition to over and above whatever the standard material was there in our standard textbooks. So this knowledge is lacking amongst undergraduates, postgraduates, and many even practitioners. Many patients come to you that but we can't say go to a sexual medicine specialist. I think as gynecologists, we are supposed to have an in-depth knowledge about this particular. It's a different branch of medicine. If you have to learn about it before you can advise to your patient. So I think the webinars like this will go a long way in educating our own doctors for having the correct advice given to the patients community when they come to you for advice. I think that is all I would like to say on this, and I want to congratulate each one of you, all three of you, and particularly Prerna and Sarfraz, and the president and secretaries of all Gujarat OBGYN societies who have joined today, that societies of Rajkot, Gandhinagar, Himmatnagar, Godhra, Anand, Nadia, Baruch, Vapi, Navsari, Patan, Valsad, and Dahod. I hardly know any Gujarati, but I don't know how to say Kem Cho, all of you. At least only 2 words I know. So the entire Gujarat family, I really welcome you and I thank you for having such a wonderful scientific program here on sexual on the platform of Sexual Medicine Committee of AMOGS. And I thank you once again, and I'm sure this is going to be a successful webinar. Thank you so much.
Yes. Thank you so much, ma'am, for taking your valuable time and being with us today. And thanks for your kind blessings.
So I may have to go because I have a physical meeting lined up in Foxy office now.
Yeah.
So I will be there for some time and then I'll go. Thank you so much, Madan, for having me here.
Okay. Thank you so much, ma'am. Welcome, Kiran sir. Over to you, Prerna.
Thank you, Madan. So it's indeed a privilege and an honor to have all our esteemed dignitaries with us today on this auspicious platform. And I happen to be from the easternmost part of the country, but as Dr. Kiran sir has in the last meeting said that I've gelled so well with all the Gujarati and the Maharashtrians. Thank you so much, sir, for telling me that. And I'm really honored to have Dr. Kiran sir as our guest of honor today. Sir has been
It's okay,
is the chair.
Prerna. It's okay,
Sir.
Prerna. It's okay. Thank you so much. Thank you today, Chief Guest, Dr. Suvarna Khadilkar, my co-guest of honors, Dr. Geetendra. Geetendra, I hope to see you at Karwar because I heard that you are also coming to Karwar. So let's see. Let's meet up at Karwar. And of course, Neeraj. I don't see Neeraj, but anyway, hello to Neeraj. and of course to you, Prerna, and Sarfaraj ji, and to all the listeners. It's a really a fantastic thing, and Madan, you have really worked very hard for this particular committee after Neeraj, and I hope, wish and pray that you take over the committee in the years to come. Similar best wishes to Sarfaraz and also to Dr. Prerna, because I also know that you are aspiring for the various positions in Foxy. So I hope, wish and pray that you get the same. As far as today's webinar is concerned, yes, as Suvarna rightly said, that the sexual medicine committee, I mean, it was not a topic or not a very commonly research topic when we were taught as postgraduates, but now today it has come up in a big way. And thank you, Madan. I really look forward to all the speakers because I see a galaxy of speakers. We have Dr. Sarfaraz, we have Dr. Shweta Trivedi, and of course, Madan and Prerna, you'll be moderating the various the panel discussion on psychosexual crisis. You know, it's a very big thing. I mean, it's really a fantastic topic. We see many of our patients, we label them as so-called emptiness syndrome or whatever. But again, the psychosexual basis behind that is very deep, and it's a very nice topic for panel discussion. I will sit throughout the webinar, Madan and
Yes.
Prerna, and will definitely listen. And also, Sarfaraz, I would like to see what you are talking about sexuality in pregnancy, because pregnancy is a state where we tell patients to remain NBM, that it's kuch nahi karne ka. So 9 months kuch nahi. So again, I would like to know what exactly you'll be talking on sexuality in pregnancy. Thank you. Thank you, Madan. My best wishes to all of you. Geetendra, look forward to see you at Karwar, and of course, wherever time comes in Pune. And Neeraj bhai, wherever you are, please keep us keep telling all the jokes in our groups. So thank you so much. Thank you, Madan.
Yeah,
And
Thank you,
Madan,
Kiran.
one more thing, Madan is organizing a very fantastic conference in Kolhapur. It is one of the first conferences on sexual medicine, which is organized by the Sexual Medicine Committee of AMOGS, which Madan is chairing, and of course with the Kolhapur Obstetric and Gynec Society, along with the 8 other gynec societies, and along with that, Madan has managed to garner in the CCP, that is CCP, which is the national organization, as well as the IMA. So I think this is the first time that such a conference at such a large scale is going on. I wish, Madan, that you put the brochure in the group so that whoever is interested, they can attend physically. And if at all Kolhapur Society is going to telecast it on any platform, they can observe it on online also. So thank you, Madan. I'll see you on 12th, definitely. And my best wishes to all of you.
yes,
Thank you.
sir. Yeah, thank you so
Thank
much,
you so
sir.
much.
Yeah, I will share the online platform link on the group. The Gujarat people can join
Yes,
uh,
yes.
to watch the online conference. Thank you, sir.
Thank you, Kiran sir, for your words of wisdom, and that was really pleasant to hear you. And we now welcome our next guest of honor, Dr. Gitendra Sharma sir. As sir practically needs no introduction, but since it is official to always introduce our guests, so we'll go ahead with it. And sir is the past vice president of Foxy 22-23, and sir had been the chairperson of the Ethics and Medical Legal Committee of Foxy 2017-19, and he has been the joint secretary of SOGOG 2017-19 and the medical legal consultant to more than 250
Madam, it's
hospitals
okay.
all over
It's
India.
okay. No,
Sir, we are so very honored to have you amongst us, and it's such a privilege to have you as our guest of honor. Sir, your words of wisdom, please.
Good evening, everybody. At the outset, I will like to pay my regards to today's function's chief guest, Dr. Suvarna Kadilkar, and my co-guest of honors, Dr. Kiran Kurtkoti sir and Dr. Neeraj Jadhav. I know Dr. Madan Kamble since long. Many years back, I went to Akluj and I was honored that I was given oration at Akluj by
Yeah,
Dr.
Shirod Corporation. Yes.
He was at that time president of Akluj Society. So I am well acquainted with the activities of Dr. Madan. In every conference, I used to see him. He is very hardworking and really nice to see that he is coming up like anything. So today, the psychosexual and sexual committee program is there. And I will like to quote that Neeraj Jadhav specifically. has given a new status to Sexual Health Committee of Foxy, because previously nobody was knowing this committee much. But once he has taken over, he has started doing so many webinars and escalating so much knowledge about this sexual thing. So everybody is now directly or indirectly attached with these activities of Sexual Health Committee. Dr. Pen, thanks for giving me this opportunity today, Dr. Madan, Dr. Prerna, and Dr. Sarfaraz Kazi. Again, in Gujarat, Dr. Sarfaraz Kazi is very much active in all the educational and other activities in Gujarat. Although I have kept aloof since long from all the activities, particularly webinars, but as on insistence of Dr. Madan Kamble, today I am here with you. Uh, I have seen that lectures to be given by Dr. Sarfaraz Kazi, Dr. Shweta Trivedi, and panel to be moderated by Dr. Madan and Dr. Prerna. So it is going to be very much interesting for all. As particularly, we all know that in Gujarat, you have taken two experts, Dr. Maheshwara and Dr. Pawan Dheer. They are definitely the master in psychosexual medicine. So really, it will be nice to see the experts and their comments. So thank you once again, and I wish that it will be a great success of this webinar. And Dr. Kiran, I will surely look to meet you in the February end at Karwar. Thank you, sir.
Thank you so much, sir. Thank you for all the blessings and your best trip. And we also seek your blessing for our upcoming event, Dr. Madan, Dr. Sarfaraz, and myself. Thank you so much, sir, for being there with us. Dr. Indra joined as of yet.
No.
Neeraj sir is not there. He is traveling.
So, we
Thank you
can
so much,
take
sir.
his blessing when he is there. Okay, you can, yeah.
Yes, thank you, Gitendra sir, for your kind blessings. And we all of three are need of your all blessings for the Foxy Committee Chairperson elections, which are upcoming in August.
Sir,
I
our
request.
best is
Yes.
always all with all of you.
Yes, thank you so much, sir. Thank you. Yeah, we will start the scientific sessions now. Shivani, can I have the CV of chairpersons for first session? Shivani? Okay. We're having first session on sexuality in pregnancy. For that, we have got fantastic speaker, Dr. Sarfaraj Kaji, who is a great friend of mine. And the chairpersons for this session are Dr. Jigna Ganatra from Rajkot, Dr. Vaibhav Kapadia from Navsari, and Dr. R.K. Trivedi sir from Godhra. Yes, Dr. Jigna ma'am.
She will join later on. Vaibhav
Okay.
is there.
Okay. Dr. Jigna ma'am is the currently president of Rajkot Society. Dr. Vaibhav Kapadia sir, who is the consultant in obstetric gynae practicing at Navsari, and he is currently the president of Navsari Obs and Gynae Society. Welcome you, sir. Next. Yes, Dr. R.K. Trivedi sir, I welcome sir. Sir is the president of Godhra Obstetric and Gynae Society currently and working at Avatar Hospital, Santrampur. Yeah, welcome sir.
Thank you.
Yeah, I request Vaibhav sir to introduce Dr. Sarfaraj Kazi. Over to you, sir. Yes, Vaibhav sir. Sir है ना?
Vaibhav hai. Vaibhav is there. RK sir is also there. Vaibhav,
Okay, RK sir, Trivedi sir, you can introduce if you are available.
Myself, Dr. R.K. Trivedi.
Yes, sir, please.
I am President, Foxy Gujarat Society. I am gynecologist at Santrampur Avatar Hospital.
Yes, sir, please introduce our speaker, Dr. Sarfraz Kaji, sir.
बोलवान किस मानू बोलवान.
Okay.
Madan, we can continue.
Yeah.
Yeah. Shall I
Okay.
share the screen?
Okay, sir, please continue.
Okay, sir, I'm stop sharing. Sarfraz sir, you can share your presentation.
Okay. Thank you very much. Is it visible, Madan sir? Hello.
No, sir, not yet.
No, not shared.
Not shared? Wait. Now?
Not yet.
Wait.
Yes, make it full screen now.
Now, okay?
Visible. Yeah, visible.
Okay. First of all, thank you very much, dear Madan and Prerna, for providing me this opportunity on this webinar. Thank you very much, Kiran sir, for your word of wisdom, Dr. Suvarna ma'am, and Dr. Gitendra sir. And welcome all the President Secretary of the different societies of the Gujarat. Topic given to me is on the sexual dysfunction during pregnancy, or you can say what you will be going to listen regarding the different aspects of the sexuality in the pregnancy. So this is the only thing which we are not asking to the patient, or sometimes patient is also not asking to us. When patient are coming for our antenatal OPD, we are counseling for everything, but the only question lacking is this. In brief, what is the woman's sexual function? It is just not a physical interplay. It is a complex interplay of, apart from physical, emotional and psychological factors between both the couples. As we all knew that pregnancy is a natural phase, like sexuality is also a natural phase. So we are considering it that this topic should not be asked, or this topic should not be discussed. But now, right now, after the sexual health committee is working so hard, and in our day-to-day practice, we are finding so much of the cases with sexual dysfunction in different categories, even in pregnancy also. Though it is not a disease, pregnancy and childbirth, so couples need not to be denied of sexual pleasure and happiness when pregnancy is devoid of any complications. What happens when a patient get pregnant in the family of the patient and in the that woman also? They are very happy to welcome the new bundle of joy, and whole family will be behind the woman, and woman starts getting so many advices: what to eat, what not to eat, when to sleep, how to sleep, what to wear, what not to wear, where to go, where not to go. But the only question or only advice he's not getting is about the sexual relationship. In our practice also, so many of us, to be on safer side, the only advice we are giving is abstinence. As Kiran sir says, no to sex. Some become liberal and they are advising that only in first trimester you should not go for the sexual activity, or only in the last trimester you should not go for the sexual activity. If we will count the period of sexual abstinence like this, starting from the 9 month of the pregnancy, after that postpartum, that woman will be at the mother's place for at least 6 months. So the abstinence period will be 1.5 year to 2 year. And this long abstinence period can disturb the interpersonal relationship, or extramarital relationship of the husband can be developed. To avoid this, we have to concentrate in our day-to-day OPD regarding giving advice about the sexuality in the pregnancy, whether it is safe or not, and we have to open up our mind and we have to open up our antenatal care with the discussion, frankly discussing with the couple. Believe me, if you will try to ask the questions, they will come up with their queries, and you will going to be solve all the queries. Normally, what happening in our day-to-day practice is this type of any sexual misbehavior or misbehavior, we are referring that patient to the psychosexual specialist. No, that is not necessary. We also should have the proper knowledge to counsel them where they have any queries regarding the sexuality, whether it is during pregnancy or whether any of the stage of their life. So what are the changes which affect the sexuality in the pregnancy? Particularly the hormonal changes, which can affect on physical and mental behavior, and that can have an impact on the sexual functioning. Which hormones? As we all knew that progesterone, which is responsible for the physical and mental changes, same estrogen can affect the sexual desire and function. Oxytocin, the hormones of honeymoon, I can say, which is released during orgasm, can cause the uterine contraction, and prolactin, which increased level can also affect the sexual desire. What are the other psychological changes which can affect the sexuality in pregnancy? Is decreased self-esteem, fear, anxiety, body image and perceived loss of attractiveness, and some myths about the sexual practice. These are some physical aspects of sexuality in the pregnancy, particularly in the first trimester. Patient will have symptoms of nausea, vomiting, urinary frequency, urgency. Then after fetal movements, some breast changes, genital engorgement, vaginal secretion, all these can affect the sexuality in the pregnancy. But all the research are suggesting that most pregnant women can engage in sexual activity throughout pregnancy in the absence of any complications. And as a doctor, we should be aware of the sexuality concerns during pregnancy to answer the queries of all the couples. Which are the queries a couple can ask us at the time of the pregnancy? Whether her sex drive is increased or decreased, whether it is safe or not. If it is safe, when? If it is safe, how? Can it harm the baby? Can it lead to the premature uterine contraction or abortion? So the question couple can ask is, will sex harm the baby? The answer is no, because the baby is very well protected inside the womb with the cover of the amniotic sac, with the cover of the strong muscles of the abdominal wall. It cannot harm the baby at all. But with orgasm, sometime there is a tachycardia of the mother, which can lead to the increased fetal movement, or which can lead to the uterine contractions, which may be mild. Patient will come with the question whether sexual desire in the pregnancy will increase or decrease. It is subjective thing. It is very individual to individual. For some, they will take pregnancy as a new beginning, and they will feel more sexy. They will increase their desire, and they are more engaged in the sexual activity. For some, they can have a loss of libido. So the couple can go either way. Either their sexual desire will increase or decrease during the pregnancy. But most researchers suggest that sexual desire during first trimester of pregnancy decrease because of all the symptoms, as I have already mentioned. And some studies also indicate that it increased during the second trimester as the patient is feeling more comfortable. And again, it decreased in third trimester because of the increased abdominal girth, or she may be preoccupied with the approach of labor and birth of the child. This is one study. According to Masters and Johnson, sexual behavior of pregnant women remains unchanged or decreased during first trimester, with improved sexual function during second trimester, and again a decrease during the third trimester. But according to the Bancroft, sexual problems are more linked to emotional and marital satisfaction rather than the trimester of the pregnancy. Some researchers also studies in 1980s and 1990s, which indicate that overall sexual satisfaction was correlated with feeling happy about being pregnant, feeling more attractive in late pregnancy, and experiencing better orgasm. So another question couple may ask, will sex be different during pregnancy? Many reports suggest that sex feels different during pregnancy. As I told, some may find it more pleasurable, for others it is less pleasurable. Like increased blood flow in the genitalia, which can lead to the engorgement, which may be cumbersome for some, or this increased blood flow in the genitalia, which also can heighten the sensation, and some people may feel more pleasurable because of this increased blood flow. Same with the more vaginal discharge and the moisturization. Different couple can have a different experience with this. There can be mild abdominal cramps due to uterine contraction after orgasm, which is normally physiological, and it cannot harm the baby, or it cannot lead to the preterm labor. The breast may feel tender and unusually sensitive to touch, particularly in the first trimester. It is so tender that the female may feel that their breast should not be touched at all. So these are the things which can affect the sexuality in the pregnancy. So what is the role of a partner if a woman is going through these all symptoms, or she is not feeling well, or she is not involving in the sexuality, in the sexual behavior, her pleasure decrease, and she is not happy with the penetrative sex? So what are the options? So partners should know if anything feels uncomfortable. If she is not enjoying, the couple can indulge in mutual pleasuring, hugging, kissing, oral sex, self-stimulation. Couple has to experiment and make adjustment according to the trimester, according to their behavior. The woman may feel too tired, moody, or nauseated to make love, especially in the first trimester. So male partners should be careful at that time. And she may feel overwhelmed by physical and emotional changes. And if a male partner will give a good support, she may enjoy this tenure of the pregnancy also. So the couple should keep the line of communication open and support each other as best as they can. So when it is should be avoided, though there is no absolute contraindication except active bleeding or leaking membranes. These are the relative conditions where we have to advise them to be careful, like any high-risk pregnancy, multiple pregnancy, bleeding per vagina, vaginal discharge with infection, premature uterine contractions are there, membranes are leaked, low-lying placenta, previous history of BOH, recurrent abortions, previous history of cervical incompetence, or partner is having genital herpes. Why these are so many questions are asking? So is it not normal if there is no sex during pregnancy? हजारों गम है दुनिया में, मोहब्बत ही का गम तन्हा नहीं, हम क्या करें, ऐसा भी हो सकता है. Yes, it is normal. Pregnancy hormones can reduce libido if one feels positive about the pregnancy, and with its associated changes, one can feel more sexual. If the woman is not happy, feeling insecure, or she might have a relationship problems, so it can have a negative effect. So what is normal for one person, what necessarily be the same for the other persons. What are the reasons for lack of desire for the dad to be? We are talking about the mom to be, but there are also reasons like fears that sex can hurt the baby, worries about the wife's and unborn baby's health, apprehension about burden of parenthood, self-consciousness about making love in the presence of the unborn child, and should discuss the fears and concerns with the dad to be also, and we have to reassure him. Some couple may ask you, is oral sex safe during pregnancy? Yes, normal sex won't harm the baby, but we have to advise them to avoid the blowing of air into the vagina because this can cause the fatal air embolism. It is safer if he can stick to the kissing and licking the clitoris or outer part of the labia rather than inside the vagina. What about anal sex? Not harmful, but just be careful if patient is having hemorrhoids or fistula. Which are the different sexual positions which are most comfortable during pregnancy? So as the pregnancy progresses beyond 4 months, the routine missionary position is not comfortable anymore for any couple. So any position which can avoid the direct pressure on growing abdomen can be advisable, like woman on top gives more satisfaction for some women, lying sideways, coming to the edge of the bed with partner standing or kneeling in front, doggy position, or just make love sitting on the partner's neck. In any position, couples should be careful that the pressure on the abdomen and deep penetration inside the vagina should be avoided. If they are feeling dryness, they can use lubricants. These are some best sex position during pregnancy. And with a little experimenting, each couple should work towards finding techniques which are suitable for them. But if they are not engaged in the sexual activity, we must have to advise them that proper communication and openness are the key to maintain or improving the sexual satisfaction during pregnancy. What will you advise about barrier contraceptions? Be sure that partner's history is not herpes. To avoid any STDs, barrier contraception should be used. Again, after all the discussions, what are the benefits of the sex during pregnancy? Apart from keeping fit and happy, it also improves the bonding and brings the couple more closer. One study also suggests that in 2004, that it improves the immunity by increasing the IgA, and which is very important to fight against many infections. In summary, better intimacy, better sexual pleasure, better orgasm, more endorphins, happy and relaxed both mother, father, and baby. What are the complications? Though there are not much, but there are discussions going on with many researchers, like preterm labor. Is there a chances of more preterm labor? No, but couples should be careful if they are having a history of preterm labor or twins pregnancy or cervical incompetence. Theoretically, there are some mechanisms which can induce labor by sexual activity, like stimulation of the nipple or genitalia, which can release the oxytocin from the posterior pituitary and which can again cause to the uterine contraction. At the time of sexual activity, there is a mechanical stimulation of the cervix, which may release prostaglandin, can cause cervical ripening, or prostaglandin in semen can also induce the contractions. Vaginal infection and prematurity due to sexuality in pregnancy, discussed with a lot of the study groups that the woman who had frequent intercourse, and if she get colonized with this type of infection, there are increased risk of preterm delivery. Frequent intercourse in women without such colonization was not associated with any preterm delivery. This is one large study by Mills and co-workers. They have followed 10,981 single-ton low-risk pregnancies and found that there is no increase in the frequency of preterm labor in women who abstain from the sex compared with those having sex. Some studies has also been done for the fetal distress. Several studies have researched that potentially negative effect of the maternal sexuality on the well-being of the newborn infant, but because of the incomplete control for co-founders and because of the small samples, it is not proved, and larger and more representative investigations have observed that there is no overall association between sexual activity to either fetal distress or perinatal mortality. Some people may have some vaginal bleeding after the coitus, especially during the first trimester of pregnancy, and will continue to have a successful pregnancy. So medical attention is needed when this bleeding is continued or spotting is continued for several days, or it is associated with abdominal cramp or passing of clots. As I have discussed, venous air embolism is quite common. Not common. A recent review of literature which identified that 22 instances of venous air embolism associated with sexual activity. Among them, 19 of 22 such instances occurred during pregnancy or the puerperium, and 18 of the 22 women died. This is all very old research paper, because right now the entity is very rare. Penile vaginal sex, especially in the rear entry position where the level of the uterus is above the level of the heart, may cause sometime increased risk of the embolism, otherwise not. After the pregnancy, then comes the period of the postpartum. So at that time, if you will ask, the last thing in the mind of the woman will be the sex, because the resumption of the coital activity postpartum has many complicating factors. And what is the traditional approach? Up to 6 weeks after delivery, postponement of the sex because of the fear of introducing infection through the open cervix, or fear of the harming the vaginal perineal sutures or the abdominal sutures. What are the reasons? These all are the reasons because that mother would be at her mother's place. She is going at the healing process. There are some postpartum bleeding or discharge. She is feeling tired, demands of the newborn, some hormonal changes that leads to decreased libido. She may having a sore breast, or she may be anxious. So physical aspect is, if you will consider that up to 6 to 8 weeks, abstinence from the sex should be advised. The sexual arousability of the mothers is physiologically reduced at that time, and the walls of the vagina are also thinner, and orgasm is also less intense. Prolactin also can increase the libido. 3 months postpartum or after breastfeeding has completed, these changes slowly regress, and some women then experience better orgasm after 3 months. What are the psychological aspect in the postpartum period? Because couple is very happy with having a new born with them, so they are not thinking about any other happiness. Many mothers and fathers sometimes they are afraid of resumption of the intercourse. New fathers may be sometimes jealous. The child is often in close proximity of the parents, so they may avoid the coitus at the time of the uh, postpartum period. American College of Obstetrics and Gynecology in 2005, they have suggested that as many as 10% of women experience postpartum depression, and this is the major thing which can affect the sexuality at the time of the postpartum period. So couples should allow adequate time for both partners to adjust their physical and psychological changes associated with pregnancy and postpartum to overcome this depressive phase. When it is safe, as I told, 6 week should be taken for different reasons. And what advice finally you will give to the patient after postpartum when they are going to start their sexual activity? So try just cuddling and being intimate at first, gradually get used to being sexually aroused, enjoy each other's company with plenty of foreplay without expecting it to lead to the penetrative sex. Use lubricating gel if they are feeling dryness. Try making love during baby's nap time. Keep doing pelvic floor exercises to bring back the muscle tone to the vagina. And if there is persistent dyspareunia, you can call to your doctor. Eat well, drink plenty of fluids, and rest whenever you can. So, what is the role of the service provider like us? That apart from any health education and preventive care or antenatal care, obstetrician and gynecologists have many opportunities during prenatal care to give accurate information and dispel myths. Many patients may be reluctant but would welcome a discussion of sexual matters if approached sensitively by us. Counseling can relieve a couple's anxiety, enhance their adjustment to their changing relationship, and which may help prevent the development of long-term conflicts. Lastly, this is the results which is revealed in 2021, according to which in order to maintain and promote the sexual health of pregnant women, healthcare providers are recommended to offer sexual health training during pregnancy along with other healthcare service. Thank you very much. Thank you, Madan sir, and thank you, Prerna, and thank you for patient listening. And finally, me, Prerna, and Madan sir, we all are contesting for the election of different chairpersons post in 2026. We need your blessings. Thank you very much. Madan?
Yeah, it was fantastic presentation.
Thank you.
All inclusive. May I request Dr. Trivedi sir to have any comment if you are there? Trivedi sir.
Hello, Dr. Kazi.
Hello, Dasna ma'am. How are
Yes,
you?
sir. Fine,
Yes, Darshana ma'am.
absolutely.
Good evening, Darshana
everyone.
ma'am.
Yeah, good evening.
Yeah.
We are very sure that all will have a fantastic win.
Thank you, ma'am.
Yes, thank you so much, ma'am. Thank you. uh, I think Trivedi sir is not there. It was really a wonderful presentation.
Thank
and
you, Madan sir.
wish you all the best,
Same.
Kaji sir. Okay. Prerna, are you there?
Yes, I'm there.
Yeah. Okay. Thank you all the chairpersons for chairing the session. And thank you, Dr. Sarfraz sir. We will move on to the next session. Over to you, Prerna.
Thank you, Dr. Sarfaraz, for that excellently elaborate, exhaustive, and informative session on sexuality in pregnancy. And we now move on to our second session that will be an esteemed discussion by Dr. Shweta Trivedi from Rajkot, who will be speaking on role of diode laser in vulvovaginal rejuvenation, and one topic very close to my heart because I myself I have been practicing cos gynae. We have a future dignitaries renowned from Gujarat, from Patan, from Dahod, and from Anand. Dr. Jalak Shah from Patan. Can we have Dr. Jalak Shah's CV, please, as a chairperson for this session?
I think she's not there.
Shivani?
I think she left
Shivani?
emergency.
He just left.
Okay. Okay, we have Dr. Ketan Patel from Dahod. Do we have Dr. Ketan's CV, please? Is Dr. Ketan logged in? We
No,
can't
Prerna.
see. No?
No,
So
no.
we have Dr. Niket Patel as well. Um, we don't have him around. So can we have the speaker CV, Dr. Shweta? Can we have the speaker CV,
Yes,
Dr.
ma'am.
Shweta
Yes.
Trivedi? That will be in the start of the, here. Yeah,
Just go down slowly. Yeah.
yes. So we have Dr. Shweta Trivedi, fellowship in minimally invasive surgery from Hyderabad, and also she is a consultant cosmetic gynecologist, and she has numerous awards and laurels to her credit. We welcome Dr. Shweta to this esteemed session, and the dais is all yours, Dr. Shweta. We are so very honored to have you amongst us. Dr. Shweta wants a share from our end, Shivani. So can you please share her slides? Dr. Shweta, are you there?
Yeah, I'm here, ma'am.
Okay. So
Yes, ma'am.
they will share the slide for you. Shibani will be sharing the slide for you.
All right. Thank you.
Okay.
Welcome, Dr. Sweta ma'am.
Sir, how are you? Long time.
After a long time.
All good, sir?
All good.
Yes, Dr. Shweta met at Hyderabad. She was
Yes.
having a fantastic talk there.
So, sir, who all are coming from AIOCG? Anyone is coming for that, sir?
Everyone.
Everyone is coming.
Yeah,
Okay, we'll meet again.
everyone will join.
Yeah.
Good evening to all the respected chairpersons and all the secretaries and presidents from all the societies. And thank you so much, Madan sir and Prerna ma'am, for giving me this opportunity. It's one of my favorite topics, sir, because I'm already using this laser day in and I know all the things regarding that. So thank you so much, sir. And I think now we will start with the presentation without taking much of the time. Can I have the slides? Prerna ma'am?
Is Shivani going to?
Yes.
Yes, who is going to
Shibani
share?
is going to share the slides for you. Shibani.
Prerna, have you
Shibani,
opened the?
Is it
No,
visible?
No.
Not yet. Yeah,
Yeah.
coming.
Yeah, it is coming.
Coming. Yeah, it's
You can put it on slide share, Shibani.
Yes, ma'am, I have done that. Is it visible now?
Your main panel is visible, not the slide.
Now?
Your main desktop, your main page is visible. Just click on the slide. Click on that slide. Click on that presentation again.
Okay.
Double click on the presentation.
Yes.
Now
Now
is
you
it
make
visible?
it, make it full screen. It's visible, yeah. Yeah, it's done. It was done, but it went off again.
Now all right?
yeah.
Make it full screen, yes. You are there also. It is a double screen. You are also there, and this is also there. Just make that slide prominent. Make it full screen. You, you just
Slideshow.
yes, slideshow.
Slideshow.
Is it visible now?
It's
Because it
visible.
is showing to
Two columns it's showing. You remove yourself, then it will come. Did it come earlier?
Prerna, it is open. Is it open from your end or?
No, it's not open
Yes.
from my
Dr.
end.
Shweta, are you on laptop?
Yeah, I'm on laptop, sir.
So it is.
Try, sir.
Is there?
Uh,
You can please try to share from your end.
okay.
Corona has to stop sharing, then only she can share.
Is it visible, sir?
Yes, yes.
Yes, it is coming.
Yeah.
Just make it
Is
full
it
screen.
visible
Slide
now?
share.
So who has shared?
And
Dr. Shweta has shared, no?
Make it the first slide.
how I'm supposed to make it?
Ma'am, are you sharing?
Yeah, I'm sharing it. I'm sharing it.
Okay, ma'am. Okay, then I'm stopping. Stop sharing.
I don't know how to make it a full swan.
Yes. Why there is no button?
It's there on your mail also, Dr. Madan.
Okay.
Right.
Shweta, can you please stop share so that I will share?
All right. I have stopped sharing.
Yeah. Visible?
Yes, sir. It's visible.
Yes, yes.
Okay. हाँ, ठीक है. Yeah, you can start.
Yes, all right. Thank you, sir. Thank you so much. So, let us start with the topic role of a vulvovaginal rejuvenation in with diode laser. So, first, I would like to tell you what is vulvovaginal rejuvenation. Now, basically, what happens is it refers to all the non-surgical group of treatments, okay, and designed to restore and enhance, and basically it improves the structure and function and appearance of the vulva as well as the vagina. And thus, it is used to improve the sexual function, urinary symptoms, vaginal health, etc. And that what is called as an vulvovaginal rejuvenation. It addresses the changes that occurs due to aging or also menopause, childbirth, any hormonal decline, or any trauma or laxity which would have happened in the vaginal area. So that is what it's called as a vulvovaginal rejuvenation. Next slide, sir.
Yeah.
Can I have the
Is it?
next?
Are you able to see the screen?
Yeah, we are able to see the screen, sir.
No, no.
Next.
एक मिनट. Just a minute. Yeah. Okay.
Yes, sir. Next, yeah. Now let us talk about some of the indications for the vulvovaginal rejuvenation. Now, what does the patient come and present with, and when we require the vulvovaginal rejuvenation? So basically, in case of vaginal laxity after the childbirth, or maybe there in case of multiparity when the vagina gets laxed, that is the time when we can ask patient for the rejuvenation. Also can be used in a GSM, genitourinary syndrome of menopause, in case of mild stress urinary incontinence, in case of a recurrent vaginal infections, dyspareunia, dryness and burning in vagina, or any aesthetic concerns related to the vulva. Next slide, sir. So vulvovaginal rejuvenation, basically it works depending on the technology. So what kind of technology each one of us have, it depends on that we can do the rejuvenation. So whether are we performing a laser with diode, CO2, urbaniac, etc., or radio frequency, or someone might go with the PRP also, and last is fillers or the biostimulators. So what I am using is the diode laser. And now let us talk about the diode laser. So what is a diode laser? Now diode laser, it is basically a semiconductor laser. And it's most common wavelengths which have been used with the diode laser is 810 nanometer, 940 nm, 980, and also it comes in a 1420, not a 24, sorry, it's a 1420 nm. And diode laser, it basically produces the continuous or the pulse light, and thus it works on the photothermal effect, which has a controlled tissue heating. Mechanism of action I will explain in the next slide. And thus further, the diode laser promotes in a collagen remodeling, also then helps in neocollagenesis. There is a new fibroblast which grows and thus improves the blood flow and gives rise to the new blood vessels. Next slide, sir. So the diode laser, what are the actions of the diode laser in the vaginal tissue? How does this works? So diode laser usually targets the water and a hemoglobin in the vaginal tissue, and thus further this laser energy is converted into the heat. This heat now, which causes a warmth in the vagina, it causes the contraction of the existing collagen fibers, and there is an activation of the new fibroblast, which stimulates the collagen, gives a new collagen growth and the elastin formation, which happens over the period of next 4 to 6 weeks. Hence, there is a vaginal tightness and elasticity, which one can feel that. So basically, thermal stimulation increases the new blood vessel formation. So there is a better oxygen and a nutrient supply in the vagina. So laser stimulation thickens the vaginal epithelium and increases the glycogen content. Hence, there is an improved lubrication and there's a reduced dryness in the vagina, which usually it is seen in the menopausal patients. Next slide, sir. Now we will talk about the role of the diode laser in a different symptoms. In case of GSM, in case of a stress urinary incontinence, in case of a vaginal chronic white discharge or vaginal dryness, itching, etc. So the role of a diode laser in a vulvovaginal rejuvenation can what it does to the vagina. It does the vaginal tightening. There's a restoration of the tone in the vagina, of course. There is a reduction in the dryness, burning, itching, pain, and any during the intercourse due to the laser, because there is a new blood vessel formation, new collagen formation, which can lead all the symptoms can be reduced, and hence there can be improved sexual satisfaction, and also it is very good, or it gives a nice sexual orgasm after the sessions with the laser. Next slide, sir. How does it help in a GSM, which is genitourinary syndrome of menopause? Now, we all know what is a GSM. GSM is a cluster of symptoms which is mostly seen in the perimenopausal and the menopausal phase. And mostly these symptoms can be related to the urogenital, vaginal health. So it improves the vaginal dryness, dyspareunia, which is commonly seen in the menopausal females due to the deficiency in the estrogen. Also, it helps in recurrent urinary tract infections, any kind of burning and irritation in the vagina. It's a best non-hormonal option in the menopausal females. So it is also useful in the breast cancer survivors and the hormone contraindicated patient. So some patients who are with the comorbidities, we can do this laser and they can be relieved with all the symptoms of the GSM. We will discuss about its role in the stress urinary incontinence. There are different types of stress urinary incontinence. We all know related to that. In where there is an cystocele is seen, there is also seen rectocele, and there is a first degree of the uterovaginal prolapse. But the laser helps in a case only in mild stress urinary incontinence. We cannot help the patient when there is a second or third degree of urinary incontinence. So how does it help? It strengthens the anterior vaginal wall and all the pelvic floor muscles. It lifts up the muscles and strengthens the muscles and the ligaments further. So not only the anterior vaginal wall, but also it strengthens the periurethral tissues. So it is useful in a mild stress urinary incontinence and improves the bladder support and control further in case of incontinence. Next, we will discuss the vulvovaginal rejuvenation benefits. What are the benefits after doing these sessions? So it lightens the pigmentation which are seen in some cases near around the vagina and also in the genital area or the labial area. So it lightens the pigmentation, it improves the skin texture, tightens it, further reduces the wrinkles also, and it's the best used in the postpartum phase. So basically, after the normal delivery, after the 6 weeks of normal delivery, we can do this procedure with the laser, and it gives the tightness and firmness in the vagina. And in any case of the age-related sagging, it works wonderful. Next slide, sir. So what are the protocols for the procedure? How we are supposed to do this treatment? So it's a basically OPD based procedure. Also, it is called as a coffee time procedure. One can sip a coffee, and if your staff is trained in doing that, the staff can also do this procedure. No anesthesia is being needed. That's why it's called as an OPD based procedure. The duration, it only takes 10 to 15 minutes for the each session. Usually 2 to 3 settings are required, each setting lasting for 10 to 15 minutes. And we usually have to give a period of 28 to 30 days between the each sessions. So, and no hospital admissions are required, and no blood reports or no investigation, no rest has been required in such procedures. Post-procedure care, how do you advise the patient after the post-procedure? So we should ask to avoid the intercourse for minimum period of 3 days. Avoid any unknown or the hot water baths for at least 48 to 72 hours. There can be a mild vaginal discharge or warmth which a patient can have it, which is normal, which we have to explain to the patient, and can resume to the routine work immediately after the procedure. There is no requirement of any rest. So these are the few indications for the diode laser, which are in menopausal therapy, as I said, GSM, stress urinary incontinence, also can be used in the mommy makeover, where there are reduced in the striations and all on the abdomen, and it works also. But for those, the settings are required more. So, and we also have to combine it with the PRP. If you combine the diode laser procedure with the PRP, it gives nice results in the mommy makeover cases. And as I mentioned, vaginal tightening, laser vaginal rejuvenation, and in case also for non-surgical breast lift. Of course, the probe used for the different procedures are different, but we can use the diode laser in all those things. And as I mentioned, there is no bleeding, no anesthesia. It's basically an outdoor procedure. There's a faster recovery, and we get the best result out of it. Now we'll discuss regarding the contraindication, in which cases we are not supposed to do the diode laser. So as usual, before starting the procedure, it is very much necessary and compulsory to examine the cervix. So before starting the procedure, we have to see, we have to do the core speculum examination. You examine the cervix, look for any cervical erosion, look for any vaginal infections, any ulcerations on the cervix. Is there any mild, you can see any CIN lesions, etc. We are not supposed to do in such cases. So any kind of active vaginal infections or PID, we can wait for some time and then we can do with the procedure. Of course, always rule out the pregnancy. Also, in case of a severe pelvic organ prolapse. So, in case of a first degree, we can still do this and it works wonderful. In case of a mild cystocele, we can do, and it gives a nice lift and there is no prolapse. The patient can avoid the hysterectomy later on. So in a mild prolapse, we can do this, but not in the severe pelvic organ prolapse. In any kind of undiagnosed vaginal bleeding and an active malignancy in the genital tract, we are not supposed to do this procedure with the diode laser. Clinical outcomes, as I already discussed it has it gives a very nice vaginal tightening, a sexual satisfaction, quality of a life in any woman has been improved, and of course it has been used in a urinary control. So it's a high patient acceptance. There is no need of any admissions, no need of any. Usually, what patient comes is, "Okay, I don't have to get admitted, doctor. I have a sugar, I have a BP." So all this thing doesn't come in a way. We can treat the patient very easily, and the improvement can be seen in the very first session itself. Next slide. Here, I would like to conclude it, and thus I would say that the diode laser is very much safe, effective, can be used with any kind of comorbidities, and it's the best non-invasive solution for the vaginal tightening, GSM, urinary symptoms, and also vulvar aesthetics. So excellent option for the modern gynecological practice, and one must to start using this diode laser. Next slide, sir. Yeah, these are the few benefits of the laser treatment which I've already discussed. And I have this machine, so that's why I have put on this photo. And it gives me the wonderful results with all the patients. And no patients have come back again with the same symptom to me. And I've been doing it since last 2 years now. And I've not seen any complications till now. Yes, so here I would like to conclude my presentation. Any questions, please, you can ask me. Thank you, sir. Thank you for the hearing.
Thank you, Dr. Shweta.
Thank you, ma'am. Thank you so much.
Thank you, Dr. Shweta. That was indeed a quite elaborate, exhaustive, and informative talk on diode lasers, and we have thoroughly covered every aspect of it. Thank you so much. Do we have any comments from any of our esteemed dignitaries who have logged in? Because our chairpersons.
I just want to add one thing, Prerna. Shweta is the only cosmetic gynecologist, second or third consultant who is doing cosmetic gynecology practice in Gujarat.
Yes.
Riddhi ma'am, and
yes.
After that, Shweta has started to practice, and now she is planning to do only cosmetic gynae practice.
Very nice.
Yeah, wonderful.
And Dr. Shweta, to compliment you.
Last year I am trained with Dr. Menon.
Yes, ma'am.
Last year I trained with Dr. Megan.
You are also
nice.
Yeah, I started slowly. I'm now planning to shift from obstetric to.
Obsession is like our. I don't know how to stop it.
No, we can't stop. But at least we can plan according to.
Ma'am, all our obstetrics patients will give us cosmetic gynecology.
Yeah,
patients.
definitely. We don't need to
They will only
find
give
out.
us the patient.
Yeah, we don't need to find out other patients, special patients.
Who do not do obstetrics will not get cosmetic gynecology.
You can just use a laser, and you can just put that chair, Amsela chair, and you advise each postpartum patient to come
to sit on Amsela.
Come, yeah.
Are like this only, like post delivery and post cesarean.
You can give a package if you will deliver. This will be the discount with.
Dr. Sarfaraz is very much a
first session of MNRA postpartum stretch mark reduction we are offering free after cesarean.
Yes.
Oh. Good.
So that's why we can influence the people. Na? More and more patients will come.
And we can create little more awareness of this type of postpartum rejuvenation and mommy mocker, and name can be different, but we can make them
for the
more aware.
Yeah. Okay. Thank you so much, Dr. Shweta, for your comprehensive talk. And thank you, chairpersons, for chairing the session. Let us move on to the panel discussion. Okay.
Dheer sir has joined, and Dheer sir is there.
Yeah, Dheer sir is there. Mahesh sir is not picking the call.
Okay. I'm trying to call him. You just continue, madam.
Yeah. Can you make it full screen, Shivani? Okay.
Sir, it is full screen already.
Yeah, it's okay. Our topic for panel discussion today is psychosexual crisis in midlife, and the moderator, myself and Dr. Prerna is with me, and we have got the eminent experts for this particular session. Dr. Mahesh Gupta, sir, who is the president of Gandhinagar OBGY Society, and respected Dr. Pawan Dheer, sir, who is from Bharuch. He's the senior consultant in obstetric gynec practice, and also is the founder president of Bharuch Menopause Society. Also, welcome you, Dr. Pawan, sir, and the panelists for this particular panel are Dr. Naisargi Patel. Can we have the CV, Shivani? Yeah, Naisargi, Dr. Naisargi, very active girl from Patan Society, doing wonderful work in sexual health, and also a member of Sexual Health Committee of Foxy. Welcome, Dr. Naisargi. Dr. Kartikeya Shastri, um, the secretary of Rajkot OBGY Society, and especially interested in fetal ultrasound and infertility. Next, Dr. Monica Batra, ma'am, consultant fetal medicine, OBGYN from Nadiad. Welcome, ma'am. Dr. Sheetal Talekar, ma'am, is not there, but she is the president of WAPI, OBGY Society. Dr. Falguni Thakkar, ma'am, who is the president of Bharuch Obstetric and Gynae Society. Dr. Sanjay Brahmbhatt, sir, who is the president of Anand Society. Dr. Darshana, ma'am, who is president-elect for 2026 from Rajkot OBGY Society. And Dr. Vishang Patel, who is the secretary of Himmatnagar OBGY Society. And I welcome all this esteemed panel for this particular panel, and just we are starting the panel. Thank you so much. Let me share my screen, Shivani.
Sure, sir. You can share now.
You know. Yeah, is it full screen?
Yes, sir.
Okay. Today's topic is very important and very sensitive also. That everyone has to look into this, every OBGYN. And this is the psychosexual crisis at midlife. Yeah. What is meant by crisis? What is midlife crisis? Actually, it is the shift in identity that sometimes affect the middle-aged adults, and this range, this age, or this factor ranging from ages 40 to 60. And what are the problems of this period, or what is why it is called crisis? Because every people have to re-evaluate their lives and confront their own mortality in this, and there are significant issues which are affecting their relationships and careers. And this crisis can affect the self-concept and self-confidence, and which leads to the so many changes, physical changes, emotional changes, psychological changes, changes in behaviors, emotions, and also which is going to affect the relationships as they are having transition to the midlife. And as we all know, the sexual function is very important and which is needed for the quality of life for a woman. And there are so many challenges in this midlife that we have to tackle it cautiously, and we have to maintain the healthy relationship between the couple, and also intimacy for women, and maintaining a healthy sexual life. And sexual function is closely related with overall well-being and relationship satisfaction. Almost approximately 45% of midlife women have sexual problems, we know. And one more fact, which is very real, that is these female sexual dysfunctions are remaining under-recognized and underrated by the healthcare providers like us. There are so many factors for that. For that, we have to first understand what is the normal sexual function. It is the complex interplay of physical, emotional, and psychological factors between the couple or the partners. And for that, we have to understand the sexual response cycle. The sexual response cycle is grossly defined as It is the fundamental interplay between mind and body. So there are four phases of the sexual response cycle. That is the desire, arousal, intromission, and resolution. And correspondingly, these disorders can be divided as sexual desire disorders, arousal disorders, orgasmic disorders, and sexual pain disorders. Yes, I will not go into so much details of this theory part. This is the Master and Johnson's linear model of sexual response cycle, and this is the circular model, which is the Basson's model of sexual response cycle, which is based on intimacy. Yeah. Yes, let us interact with our esteemed panel. Yes, I would like to know which factors affect this sexual function. These are the
Yes,
basic
sir.
questions.
Good evening,
Yes,
sir. Thank you
yes.
for giving this opportunity. So many interconnected factors play a role in shaping this individual sexual functions. And sexual health is depending on the balance of physical, emotional, and relationship factors, like biological and physical factors in that hormonal changes. In women with age, estrogen and testosterone is declined. In men, testosterone is declined. Chronic illness like diabetes, mellitus, hypertension, hypothyroidism, then heart disease and kidney disease. Neurological factor like multiple sclerosis, then spinal cord injury, trauma, then pain disorders like vaginismus, vulvodynia, medical disorders, then medications like SSRI, antihypertensive, then psychological factors influence like stress, anxiety, depression, sexual abuse, past trauma, then relationship factors like lack of communication between the partners, identity issues, lack of emotion, intimity part, then social factors like lack of sex education, social cultures, guilty, then taboo, then lifestyle factors like sedentary lifestyle, poor diet, obesity, lack of exercise, that all influence factors for sexual dysfunction. Even age-related factors like menopause, vaginal dryness, erectile difficulty in male, and reproductive gynec issues.
Yes, you are absolutely right, Naisargi. The biological factors are so much important, and as well as at the same time, the psychological factors are very important, and that are going to affect the interpersonal relationship. That is interpersonal factors. That means relationship issues. Yes, you are absolutely. Yes, anyone would like to add from our panel?
Actually,
Anything to
these
add?
days, malignancy is increasing. So those who are cancer survivors,
Yes,
they
ma'am.
face issue both physical, their because of their pathology as well as their treatment, and psychological. Second, very important is changing lifestyle. Number
Yes.
of the one point is there either loss or gain of partner. That is now there are multi-sexual partnership are there, and then there is a confusion in between relationships. So changing lifestyle make a huge role these days, and very important is menopausal women, or
Even in
rather,
male prostate.
yeah, that is what I will call as a andropause male.
Yes, ma'am, you are right. Uh, there can be so much large discussion on every aspect that just you have stated. It's a very large topic. Yes. We all know what are the symptoms of this menopause, or these cycle changes are there: hot flushes, tiredness, loss of libido, anxiety, and mainly the physical symptoms like dry vagina, discomfort, etc. There are so many symptoms. And why this is happening? There are so many changes occurring. The vagina, how looks before menopause and how it is looking after menopause. Uh, the vaginal lining thin and thick and moist. They are flexible, which becomes the flexibility decreases. Vaginal lining becomes thin, and the blood flow also get reduced in the menopausal patients. There, Prerna, are you there?
Yes, I'm there.
Yeah, can you take over?
So thank you, Dr. Madan. And we really have a esteemed string of panelists with us to answer all questions about the midlife crisis and sexuality. So, moving on to the next question, let me have any of our panelists to answer this on how sexual dysfunction affects the quality of life. As we all know, This is somewhat related to a crisis period where we all feel low, the emptiness syndrome, as Dr. Kiran had said, and so much and so more. So can you throw some light on that, the quality of life, how it deteriorates with this midlife sexuality crisis? Anyone? Dr. Kartike, Dr. Falguni?
Yes, ma'am. Good
Yes.
evening, ma'am. Ma'am, it will have impact on both the mental status of the both partners and the marital status of them, including the every disharmony, right from their self-esteem to depression to all the psychological changes the sexual dysfunction can have, and so forth and so on. Even increase and decrease libido, the change in the libido can have the effect on their interpersonal relationship, leading right from anxiety, depression to unhappiness, irritability, even change of partners and infidelity. So this has got a vast area of impact right from their sexual life to the marital life, ma'am.
Dr. Falguni, you are adding on something? Dr. Falguni?
And yes, as it is mentioned on last line, that we should not forget the male partner in sexual disparity
Yes, ma'am,
and
please.
the sexual dysfunction. He
Yes,
may
ma'am.
be having functional problem. He may be also having psychological issues and physical problem also. So we should not forget male partner also. And what I have experienced for years, when they are when we are counseling them personally, it sexual dysfunction sometimes reveals partner specific also. One may be comfortable with one partner and not be very happy with another partner. So we should not forget both the parties, that is male as well as female in couple, and we should counsel them perfectly and separately with maintaining their private this aspect of the relationship with when they are discussing with ourselves. So
Very
which
right,
is very
rightly
much
taken,
important
ma'am.
when we are discussing dysfunction in couple.
Dr. Falguni, you want to add something?
Like
Yes, ma'am.
patient is having vaginismus, and because of that, it's they are not able to tell to doctor or family people. So after 6 months of long duration, male partner is started developing erectile dysfunctions.
Yes, that's a very common thing seen in a number of people.
Yes.
Yes.
And
So,
basically, it's a vicious cycle. Whenever the relations are not good, their social harmony or disharmony is there in the family, that leads to sexual dysfunction. That increases the disharmony, that increases the sexual dysfunction. So sometimes I feel that it's always good to send them to the counselors also, maybe some psychotherapy also, along with the treatment of their sexual real problems which they have, the physical problems or the pathologies concerned with it.
we have our expert, Dr. Pawan Dheer, sir. Sir, can you throw some light on what our panelists have added just now? Sir will be able to. Pawan, sir. Sir, are you there? Dr. Pawan Dheer, sir. So we'll take his opinion in the next slide. Coming to the classification of female sexual disorders, as we all know. Yeah, that is about DSM-4 criteria for female sexual dysfunction, which was an old classification, and now we have the DSM-5 criteria that includes the female sexual dysfunction, including the sexual disorder. Disorders, arousal disorders, orgasmic disorders, as well as sexual disorders, orgasmic disorders, as well as genitopelvic penetrative disorders. So we have to first classify whenever a female comes to us as on which order of importance and which order of problem that she is actually facing. Can we have the next slide, please? These are the if we talk about female the criteria, can you take up this, Dr. Madan? Yeah. Anybody from anyone in the panel can take this up as the criteria for female sexual interest or arousal disorders. Any?
Yes,
You just
yes.
put the slide on the screen and it is clearly mentioned. You just share
can
the
I
slide.
take it?
You just share the slide.
Yes,
What are the
ma'am, absent or reduced sexual interest, arousal with at least 3 out of 6 criteria, like reduced interest in the sexual activity, reduced sexual or erotic thoughts of fantasy, reduced initiations of sexual activity or typically unreceptive to partner's attempt, reduced sexual excitement pressure during the sexual activities more than 75% of encounters, and reduce the sexual interest, arousal in response to internal causes, reduce sexual interest, arousal in response to erotic stimuli and visuals, and reduce genital or non-genital sensation. So out of these 3 criteria, it should be there. Even additional requirement like it should be more than symptoms most should be more than 6 months, clinical significant distress, no better explained by the non-sexual mental disorders, severe stressors, relationship stressors, and medical comorbidities. Even medications, what they are using like antipsychotic drugs, SSRI, and anti-androgen drugs, that also will affect this.
Very well taken. So this is about the Placid model, where we can evaluate the female sexual disorders, that is disorders of permission, limited information, specific suggestions, and intensive therapy that can be given. So this is a very interesting model where we can evaluate the female sexual disorders. So it is very important and very pertinent to recognize what underlying conditions are contributing to the reduced desire of sexual intercourse, and mainly it is about major relationships issues, soliciting more detailed information from patients about their experiences of low desire, the onset, duration, behavioral adaptation, and avoidance, and level of distress that is going on between the partners, as well as close evaluation of the patient's medical history, comorbid conditions, and use of prescriptions and over-the-counter medications. This is an array of evaluation that is needed when it comes to FSD. So, Dr. Madan, can you take this up?
Yeah. Regarding the orgasmic disorders, then what are the defining criteria for the female orgasmic disorders? Yes, anyone can take this question.
So whenever the symptoms persist for more than or equal to the duration of 6 months, like in almost all or most of the occasions of sexual activity, the partners are complaining of maybe delayed or almost absence of orgasm, or say decrease in the intensity of the usual orgasm that they were experiencing prior, the which the difficult orgasm or the delayed or decreased intensity of orgasm that is to the severity or to the extent that it can lead to the mental distress or even interpersonal problems between the couple. And last but not the least, we must rule out, exclude the other physical causes of orgasmic dysfunction in any couple.
Yes, Kartikeya, you are absolutely right. Last three factors are common for every sexual dysfunction. There should be distress or interpersonal problem, and that the symptom should be at least for 6 months. And these are the types of anorgasmia. That is the primary anorgasmia, secondary anorgasmia. In primary, she never had orgasm. In secondary anorgasmia, previously they used to have orgasm, but now there is difficulty in reaching the climax. And situational means they can feel orgasm only in certain circumstances, like oral sex, masturbation, or with certain partner. And the generalized anorgasmia means there is no orgasm in any situation or with any partner. That is very important. Then, what are the causes of painful sexual act or the sexual pain
It's
disorders? What are the
Sir,
causes?
dyspareunia, vaginismus, then dyspareunia may be it's penetrative pain like place of lubrications, dry vagina, trauma, irritations, vaginismus, congenital anatomical problems, deep penetrative pain like certain gynec conditions, surgeries, emotional factors like psychological issues, stress, sexual abuse, and past history or past trauma. Vaginismus, it's like mainly involuntary contraction of the pelvic floor muscles and painful intercourse. Earlier, it was like involuntary contraction of the muscles, but now recent definition is involuntary contraction of muscles, and the woman is allowed vaginal entry of the penis, fingers, or any objective, and despite of the woman's expressed wish to do that. So it's recent definitions. It has a 5 grades: grade 1, 2, 3, 4, 5, and 5 is the like patient is having so much pain and patient is not allowed us to do any examination or touch.
Yes, yes, there are sometimes visceral responses. That is the highest grade of vaginismus. Yes, you are right. Then, how to evaluate the female sexual dysfunction case? Any case when it comes in your OPD, how will you go ahead?
Sir, mainly it's commonly we have to take detailed history. First, we have to make patient comfortable and like get their trust on us, and like detailed history about their menstrual history, their sexual history, plus their family history, and what is the intimate history is there in bedroom history. That also we have to take any family, any past history is there, that both partner differently we have to take, and together also we have to take any high risk factors, they are having any comorbidities, then medical history, then after that physical examination also we have to do for individually male and female partners. So female partner, any vaginismus is there or any vulvodynian conditions like a stenosis or any dry vagina, anything that we have to examine.
Okay, pelvic examination is very important. Yes. Yes, yes.
Further investigation, if we won't get any in history, then we have to go for USG or CT MRI to rule out any pathological conditions. And lab investigation in that hormones are very important, but mainly history, it's depending on history.
Yes, Dr. Naisargi. Yes. What effects will menopause have on sex life? We all know menopause is going to affect your sex life, but how it will affect? Yes, Darshana ma'am.
Actually,
Yes, anyone? Right?
Yes, it is due to first and foremost is reducing hormonal level, which can make the vaginal tissue more drier, thinner, and as you have shown in previous slide, that stratification is lost. So
Yes.
their vaginal epithelium get flattens and there is no secretion. Even vascularity is also decreased.
Yes.
There is a painful intercourse, and second is because of lower hormones, there is a lower sexual desire too. Hot flushes are there, so the lady's sleep is disturbed. There are emotional changes which she is feeling alone now suddenly because children are not there. Husband is busy with his career and other goals, and she is all. She felt she feels most of the time. Sometimes loneliness is more there, if, especially if she is not working. She is more worried now because of body disfigurement that her beauty is going to loosen. So it is a complex physical as well as psychological and emotional turbulence in life of a woman at the age of menopause when her sex life and priorities get changed.
Yes, absolutely right, ma'am. Multiple factors are coming into that which are affecting the sexual life of a perimenopausal woman. Yes. Anyone want to add something? Is there Dr. Pawan sir is there or is not there? Prerna?
Yeah, sir is not there. I asked
Okay.
him to chip in.
Okay. Many points have been covered by Darshana ma'am.
even
Yes, Naisargi, do you want to say anything? Okay. Yes, can you take?
Sometimes there are so many other medical disorders which appear at the perimenopause and menopausal age that we have to consider other than menopause also. If there are any medical disorder like diabetes, hypertension, malignancies, history of malignancy or malignancy treated, history of diabetes, then these cardiac problems also, and these days sedentary lifestyle also affects menopausal women for their sexual esteem as well as physical confidence.
Yes,
So,
ma'am, absolutely right. These medical conditions and the medications which are
if she
needed
is
for this
taking,
treatment are going to affect the sexuality, definitely. And
So one
especially the malignancies and the treatment of malignancies. That is going to affect the sexuality along with the age factor. Yes, Prerna?
Once we discuss the problems, we definitely need to find a solution to all those. So, any panelist can take up what measures that we can advise to improve such disturbances in sexual health in such aging females. Definitely
Mainly, ma'am,
start with, yeah, please.
mainly it's couple communications. Mainly, they have to spend time together. We have to counseling them, and we have to ask. Then later we have to take detailed history.
Mhm. Tender loving care that we all expect from each of
It
our
implies at
partners.
every age, not only menopausal age. Tender loving care is,
Yeah.
it is,
Is
for
it
me, it
every,
is the best remedy for every solution.
yes, ma'am.
Yes.
Very true, very true. So, apart from allowing time to have that foreplay and also practicing a lot of products which is not irritating the vagina and all these stuff, we need to have a total evaluation and give them certain remedies for what they're suffering for. And the lubricants and vaginal moisturizers can be used for their dryness part, and the GSM of menopause should be treated with care. The top priorities
I
the woman need on today's date
want to
is
know one
general well.
aspect of vaginal moisturizers. These days, there are so many advertisements which are flowing on media, vaginal moisturizers and these lubricants. So,
Mhm.
anyone can throw some light on commercially available vaginal moisturizer and lubricants, because couple are using so many different things like the skin moisturizer, coconut oil, ghee, and so many things. And now
Mhm.
it is commercially available on social medias too. So, what is
Mhm.
medically best moisturizing option if anyone is using,
Ma'am,
And me,
actually, from
except
West Coast,
estrogen
it's
therapy?
coming a vaginal moisturizer name only it's coming. That is water-based jelly. That it's coming. Before that, KY jelly is also coming. And before Isrin, it stopped, ma'am. Otherwise, isoflavone-based jelly was coming. But for that was for perimenopause and menopause. But normal people, it's vaginal moisturizer. That is water-based jelly. And KY jelly, Lubic jelly, that is there available, ma'am.
mhm.
And it
Not
has
a
good
single,
result.
yeah, not a single brand can be
Yeah.
yeah, it cannot be affirmed like that, but we need to have a lot of studies for this because we are usually medically we are using this estrogen gels also that is weekly for
Some
1 gram. So,
some lubricant gels are available which are sperm friendly, which are not
mhm.
spermicidal,
Yeah,
and
it
these
is
are
started.
advised
Yes,
during the
non-spermicidal.
intercourse period. Yeah, in the treatment of infertility cases. For example, Feminora gel was there.
Yeah,
Feminora.
Feminora is I have used
Yes.
Feminora.
Yes. And in perimenopausal, we can have from Himalaya, there is V-gel also. Himalaya.
I did, okay.
Yeah.
Every
And
day
for
one has to insert Himalaya
Yeah.
wala.
Yeah. Oh, there is not specific dose. Daily it can be used.
Oh,
Daily.
even for vaginismus, sir, we have to counsel them. Then for every week, we have to teach one therapy. Then later, we have to ask them to follow that. Every week, we have to give them homework after
Yeah.
updating them.
That is
And
the
not
part of treatment of vaginismus. Yeah.
yes, in that.
Uh, Prerna, can you take these scenarios?
Yes, so a little twist onto our tale. We have filled in a little bit of more masala, you can say, with this panel. And there we'll give you a scenario. Anybody, Dr. Uh, Darshana, Dr. Kartike, Dr. Falguni, everyone is participating so well in the panel. This particular female is suffering from this called something called the unfulfilled desire, where she's 50 and she feels a strong desire for intimacy, but her partner isn't interested at all. So she's wondering if she is still attractive or desirable. So how will you give her a fruitful solution on this? Any
So,
panelist?
main ma'am, we should beginning with non-judgmental assessment. We should
Mhm.
ask them a full relationship history, timing problem, sexual medical history, medication, or all detailed history. Because
Okay,
desire
Lester,
problems
we can't see you. I
always
don't know why your video is off. We can't see you.
Now you can see me.
Yes, yes, we can see you. It's always good to see each other. Yeah.
Because desire problems are always multifactorial. So relationship, hormonal problem, or any medications problem. So we have to take detailed history without judgmental. And then we should treat the screen and treat them according to that.
Yes.
And
Dr.
Because if
Karthikeyan?
it's 50
as
years,
as
so we should
previously
go for hormonal things, hormonal structures. We have to see like what is the level of hormone and again examinations.
as Darshana madam previously also enlightened us that while entertaining such cases, we should not forget the male partner.
Male
The partner who
partner.
is not
Why he is
interested.
not interested in
Yeah,
particularly Miss Priya?
yeah.
He may be interested with some other
Yes, ma'am.
lady. So
That
we
part also must
counseling
not
is
be
very
made.
much important. And
True,
if
madam.
there is any pathology with male partner, we should address it. We should counsel male partner also separately. If there is no interpersonal relationship, then we can support female that she is always attractive and desirable, even irrespective of her body appearance and age and superficial beauty. So first
Yes,
and
ma'am.
to increase the interpersonal relationship transparency.
Yes.
Then
And
about confidence in female herself that she is still attractive, she is still desirable. Then say that any good sexual partner is what I believe is best Viagra for any sexual solution or problem. So she should be more confident about herself only. Then partner will be interested in her also. So to
mm-hmm.
build self-confidence in women is psychologically utmost importance for me.
Very
Even we
important,
should
ma'am. Very, very well
be
taken.
sunset focus, ma'am.
Yes, very, very true. First, we have to tell the female that yes, you are still beautiful. That is one sentence that can build her inner strength and inner compose back again on the bed, so that she doesn't have that problem of image, body image. Dr. Madan, Dr. Madan, you want to take this?
Prerna, you please continue.
Okay, so we need to guide her now regarding this particular syndrome, which we have been talking right from the very beginning of the webinar. That after her kids leave home, she is all alone. She is already 48, and she is having a mix of field emotions, where she's excited for this new chapter of having midlife, but then she struggles with her new identity and her sex drive. She's feeling so empty. She's feeling so looped out. She's feeling so aloof. So what can you do to guide her in such cases? Anyone can take this.
We
She's
should
all alone.
yes, we
Yeah.
should counsel her that just reflect on yourself and try to reframe everything. The only goal, honestly speaking, is to assess your life and try to focus on the controllable aspects of your life. You can prioritize your self health, you can prioritize your self well being, self care, cultivate new hobbies, try and focus more on your physical health and appearance, and tackle the absence of children, which is part of everyone's life.
Very, very well taken,
Then
Dr. Karthikeyan.
Nowadays,
Yes,
we around
everyone.
30s. Children live early now these days. So it is
Mhm.
they till 48 or 50s. This problem is now starting earlier.
Mhm.
even
Very,
we
very
can tell
true, ma'am.
them reconnect with partner, then build up your new relationship with your partner, then suggest them some project like go for night date, do works together, discuss your problems, your good things or bad things. So they'll get good communications, they can know each other very well, and they can build good relationship in between. Even we can ask that lady to build up new friendships also, and social things, social get together like that. So she'll become independent, I'm like confident, and she can build up her relationship better.
सिंपल शब्दों में बोलते हैं ना, पार्टी करो, पार्टी करो.
अभी तो पार्टी शुरू हुई है वो that this is
Mom, it's like that after 40, everyone, every female should go for party with female.
Yeah, very
That
well
is
taken.
best
That's an
place for
essence.
her.
Yes. So can we have the next slide, please? Can we have the next slide, Dr. Madan? Dr. Madan?
I am leaving. I have to see one patient in post
Okay, ma'am.
got.
Okay, thank you so much, ma'am.
We have operated one extensive endometriosis
Oh,
today. I need to
acha.
say that. So I am
Okay.
leaving. Meanwhile, if
Okay, thank you so
till
much,
then I
ma'am.
will rejoin again.
Okay, okay,
It was
ma'am.
wonderful talking to all of you.
Okay, ma'am.
Hope to see you at AICUG.
Yes, ma'am, definitely.
Okay.
So we have this
And
body image issues also with females around 45, which is they have a self-consciously changing body and having a because of that they are avoiding intimacy with their partner, and the rest emotional connection is good, but then because of their insecurity and their concerns about their body deteriorating into figurement, and so that is why they have a low self-esteem and they avoid sexual intercourse. So how can you deal with that? We have already spoken about it, but specifically, how can you deal with this body image issues?
So again, the hormonal transition, which will have the effect on her lean body mass and the fat gain and the disfigurement, but not trying to focus on the effect of the lack of hormones, but rather focusing on how to improvise our own physical health and well-being. That will be the I think pivot for the counseling purpose.
Yes, yes,
We'll ask
very,
her to
very.
go for exercise, meditations, yoga, so she can make her body image properly. And we'll ask her, you go for some walk also and make some female friends and love yourself. First thing, love yourself.
One thing is for sure that all our panelists will never have a midlife sexuality crisis. The next slide, please, Dr. Madan. The relationship shift again after 20 years of marriage. This particular female who is already 52, she realizes that she's not getting the emotional connection she craves, and that happens so very quite often with every couple. And she's questioning her desires and wondering if it's time for her to change, or for her partner to change, or whether she needs a complete workup of emotional issues between both the partners. So how do you take this ahead if we
First, we
really
can
face
ask
such a
her to
situation?
reduce guilt and help her approach to issues like rationally instead of impulsively. And we can ask her to explore emotion disconnect. When did she start feeling disconnected? How conflict, routine, fatigue, communications, how much relationship with her partner, how much time they are spending with each other. That is very
अपनी
important. Then
अपनी
encourage
खुशी की चाबी
communication.
अपने पास रखनी है. अपनी
Then
खुशी
we
की
can
चाबी
ask
अपने पास
her
रखनी है.
we can ask her to encourage communications with partner frequently, go for dates in between, then have a intimate relationship in between, like in a week, 2 or 3 times. So that will improve their bond. Even in between, they can change their bedroom scenarios and
Okay.
like different things. They can go for vacation, like only husband wife, like couple.
One thing, Nasargi, I counsel to such patients of mine in my day-to-day practice is that you stop expecting much from your partner. Once you stop expecting much, when does pain come? Emotional pain comes with a lot of expectations. When you start expecting that your partner will be waking you up from sleep and you'll be serving you a cup of tea, that is where you get disturbed, right? So if you stop a certain amount of expectations is good, but then leaning on much to your partner at the age of 52 gives a lot of trauma to the couple. So they should be cool about it.
Ma'am, what we should do, like both partner when we will counsel together, that time we should tell every individual person is individual. You are a couple
Yes.
in some scenario, but you have an individual life. So you should live your life also independently. You should like live your life, not together only. You should not depend on each other. Then they can
Very.
understand their expectation will reduce. So
Yes,
their
yes.
married life will be good.
Can you have the next slide, please? This one also is a very important thing that we have discussed so much in detail about the loss of libido around that age and the discomfort that resolves around sex. So she's worried about whether the loss of libido will affect her relationship. So we have already talked about it that this emotional connection should be more than going on to penetrative sex. So this is a very important thing that we have already discussed. So we can have the next slide, please. Uh, Yes. So can you take this up? This female was divorced in her 50s, and she's rediscovering herself. Now she's curious about her new experiences and connections, but is nervous about judgment also. So how good is it to explore herself, re-explore herself at the age of 50 after a divorce long back? Can somebody, because it's a very common scenario nowadays. Female gets divorced at 45, 50, and then they search for new partners, and then they end up into having a nervous anxiety disorder.
So during asking history, first so we should not be judgmental and we should trust, like we should gain trust, and we can ask like, do you have any this sexual desire problem or anything? If she is not having and she is only worried about society, then we should explain her. Society is, you don't bother about society because it's your life, you have to live. And if you are sexually active, your 50% problem of medical problems, it will reduce. So you don't think about society. It's your life, you should live. So be confident. You don't need validations actually.
No,
Yes, very true.
no
Yes,
need to
yes, Dr.
suppress her. No need to suppress her own feelings. I think we should appreciate and acknowledge whatever the emotions she is going through. As Madam told, rather than looking for validation, just acknowledge and let it go.
Yes. And
Yes.
we ask her like you live your life properly, like proper exercise, good sleep, proper healthy diet, and mindfulness. So that is helping her instead of
Just,
worrying
just
about society.
just one word about making her sure that she is not ending up into having any STIs with the new partner. It's very important at this age. It's very, very important. So when she is on to a re-exploration phase, then she shouldn't, they should be more careful than excited. So that is very important. So can we have the next slide, please? So, Dr. Madan, can you put on with the take-home message and anybody, Dr. Madan, are you there? Yes.
Yes, all the panelists have given their great inputs, and it were wonderful scenarios added by Prerna, very well discussed. The take-home message from this specific and very sensitive subject, that is crisis. What we can do: understand your body and what makes for a healthy sexual response, and um, we should follow or try to follow the some specific things to overcome that, like everyone should be physically active. We can advise some pelvic floor control exercises, and everyone should have healthy habits, healthy diet, and everyone should take some time for leisure and relaxation, and take out a trip with family, spend some time to have emotional connection again. And age wise, the changes which are occurring, that we have to accept and behave accordingly. And most important pillar is the open communication and or transparency or open communication with your partner, that is going to build your emotional bonding or connection, that will improve the intimacy with your partner. And always take some time for sex, because our profession is such a busy, or anyone, as far as the patients are also concerned, everyone is busy in their day-to-day task or any business. We should have some time for sex, and there are counselors available if needed. And you have to manage your stress or any work related anxiety or any stressful situation that you have to handle, and come out of that to have a healthy life or healthy sexual life. Yes, anyone want to give? I urge every panelist to give one message, take home message from their end in a single sentence. Naisargi.
So we should ask our every couple should spend every day half an hour with each other. That is the
Oh,
best
Yes,
wow.
medicine.
that's very nice thing. Very nice thing.
Half an
We are
hour.
telling our all patient who is coming every day. We are explaining half an hour you spend with each other, and just with like you keep your hand on her back, so she'll be fine.
Oh, somebody said this was three 7 minute schedule, 21 minutes. So 7 minutes in the morning, 7 minutes in the afternoon, and 7 minutes in the night. There's a TDS dose of keeping the
Oh,
hand on the back.
yeah, that's Prerna's criteria. Suggestions.
But really, sir, this is like, so when we'll tell these things to husband, wife will be so happy and that pain will be okay. She'll fine.
They're absolutely right. Yes.
Dr. Karthikeya, you want to add something?
Communication is the key. They should be communicating with each other. About everything, their flaws, their fantasies, everything.
Very good.
Rather than
Dr.
keeping to
Jigna,
themselves.
Dr.
Communication.
Jigna, Dr. Pawan,
Yes, yes.
no,
They should
anybody is ready?
express the feelings towards each other. Feelings express करना चाहिए, time निकलना चाहिए और communication चाहिए. बस, that's all. Yesterday only I saw one patient, a couple. He came home to me for reduced desire. When I asked them, their occupation was a vegetable seller. They were having one shop. They used to wake up at 4 a.m. and they are working till 11 p.m. and they had dinner at 12 in the midnight. How there will be desire? How there will be time? So many couples are there in the society.
Very important is a mobile-free zones. The bedroom should be a
Yes,
mobile-free zone,
ये तो
cell-free
नहीं
zone.
ये तो नहीं हो सकता.
but you can ask them for digital
लोग
detoxification after 10 o'clock.
लोग बोलेंगे बीबी को छोड़
One
दूंगा,
one
मोबाइल नहीं
couple the
छोड़ूंगा.
other day, one couple the other day, Nasargi and Kartikeya and Madan, they came and they said that the wife said that I'm pissed off with my husband's routine of watching reels at night after 10 p.m. So when I asked him to not watch reels in front of me because my sleep is disturbed, he started using headphones. That's all he did.
That's why I'm saying मोबाइल नहीं छोड़ सकते.
मोबाइल
Okay.
मत छोड़ो, केवल नेटवर्क जो मोबाइल डेटा है उसको ऑफ करना है.
So we can conclude the session, Dr. Madan.
Yes.
Yes, so it's customary to extend our vote of thanks, and we are in depth gratitude to everyone who has joined into this webinar today to make it a success. Our chief guest, Dr. Suvarna, our guest of honor, Dr. Kiran, Dr. Gitendra Shar, and Dr. Neeraj Yadav sir, and all our esteemed chairpersons, speakers, panelists, and everyone, all delegates from far and near, and everyone from the Gujarat societies, so much so that we have been able to take this through. And our Corona remedies, our tech support, Dr. Madan, Dr. Sarfaraz, and myself signing off for now, and seeking your blessings for the committee chairperson elections. Dr. Madan is going for Sexual Medicine Committee and Sexual Health and STI Committee. And myself, I'm going from Young Talent Promotion Committee, and Dr. Sarfazaz is going for
Medical legal.
medical legal. Yes.
Yeah.
So we seek all your blessings and support in the times to come. Thank you
Yeah,
for being
all
there.
Gujarat societies, we want to appeal. All Gujarat
All
societies.
three of you, ma'am, and thank you for opportunity.
Thank you, sir.
Thank
Thank you,
you.
ma'am.
Thank you so much.
Yes.
Thank you.
Thank you,
Dr.
everyone.
Yes.
Looking forward to many more webinars with you all. Thank you so much.
Yeah.
Okay.
Thank you,
Bye-bye.
Corona Remedies, for your assistance. Thank you so much.
Thank
Yes,
you.
thank you, Prerna. Thank you, AMOGS. And thank you, Gujarat. Thank you so much.
Thank you.
Yeah. Shall we end the meeting? Yeah.
Yes.
Okay. Yeah.
Okay.
Chalo. Good night.